मैं डॉक्टर भारद्वाज हूँ. I am an ENT specialist. I served in the army for 15 years, following which I am now in private practice in Vasant Vihar in South Delhi. Today my discussion will be about epistaxis, which is nasal bleeding. Nasal bleeding is one of the commonest problems associated with children as well as with elderly people. In children, the cause can be because they insert sometimes a foreign body in the nose, maybe because of an infection, sometimes because they dig their nose, and can be also because of a sinus problem. We usually try to find out the cause of this bleeding. We put in a nasal endoscope, we diagnose the source of the bleeding, and we seal that blood vessel via a procedure called nasal endoscopy and cauterization. This is a safe procedure and well tolerated by children. Nasal bleeding, the diagnosis should not be delayed because sometimes there may be a serious cause. In the elderly people, because of high blood pressure, because of bleeding problems, as well as medicines that they take for heart problems and vascular stents, they have more nasal bleeding because their blood has become thinner. In these patients, you should not delay having it diagnosed properly as well as being treated. The procedure again will be in the clinic setting. We put in a nasal endoscope, we identify the source of the bleeding, and then we cauterize with the chemical or with electrical diathermy. In children, if they are bleeding at home, the first aid methodology is to pinch their nostril so that with pressure you can stop the bleeding, and also try to apply some cold packs around the cheeks and around the nose so that the bleeding can stop. It is better to make the child sit up rather than lie down, because if the child lies down, the blood is likely to trickle to the back of the throat. For any problem related to nasal bleeding which is not being controlled, you're welcome to contact me through Lybrate.com on the various platforms that are available, including sending me a query. My clinic is always available to take care of these emergencies, and you can get in touch with me through Lybrate.com.